So mastectomy is often done for breast cancer.
Right.
Okay. So in early stage cancer, we can plan the surgery in such a manner that as soon as the breast is removed, it can be reconstructed in the same setting. So we can plan it in that manner so that when the woman wakes up, she doesn't actually bear the burden of breast loss at all.
Right.
Okay. So this is how it is done. And in later stage cancers, we often have to wait for a period as determined by the oncologist to wait, so that if there is no recurrence, then one can go ahead with the reconstruction at a later date. So basically this surgery can be done in 2 or 3 different ways. One is a implant surgery, where if there is sufficient skin envelope already available,
Right.
and one can put in a breast implant in that area, or an expander implant, expand the skin and then put in an implant.
Okay.
Or one can use body's own tissues, which is known as a flap surgery.
Right.
Tissues can be used from patient's abdomen, from the back, or from the buttock area, and this tissue is then used to create a breast mound in the place of the breast which has been excised.
Okay.
And third is person's own fat, so which is known as fat injection technique.
Okay.
In that, person's fat is taken from areas which have got an excess of fat, like abdomen, buttocks, back, and this fat is then injected into the area where future breast is supposed to be there, or from where the breast was removed. But usually this takes around 3 to 4 or 5 settings at monthly intervals before you can achieve a reasonable shape. With this technique you can achieve an average size breast, and with the person's own breast, own autologous tissue or flap surgery, especially from the abdomen, one can achieve nearly normal size breast.
Right.
Implant can only be done if sufficient skin envelope is available, and technically that would give the best result, because you can choose the size of the implant to be as close as possible to the opposite breast. So size wise, one can very nearly reach the opposite breast size. Shape wise, the normal breast is teardrop shaped. It has got a slight hanging, while the implant is more or less circular. And so some matching can be done either by modifying the normal breast to meet the size of the reconstructed breast, or later on in secondary surgery. See, with any surgery there is a risk of infection that can happen in any surgery, not only in breast augmentation or breast reconstruction, but in any surgery. Okay, it depends again on the type of surgery. I told you there are 3 types of surgery.
Right.
So in case of fat injection, there is no hospital stay that is required. The patient can get the fat injection and go home immediately.
Okay.
While in breast implant surgery, we usually retain the patient overnight, or just to give intravenous antibiotics to prevent infection.
Right.
While in case of flap surgery, patient may require 2 to 4 days of hospital stay, because she has 2 sides to heal. One side from which the flap is taken, and the other where the flap is put in. Immediately after surgery, there is need for injectable painkillers.
Right.
Okay, but that need is there only for 1 or 2 days.
Okay.
After that, one can very well manage on tablets and capsules that are routinely available. And yes, local doctor can take care of the patient in the long run. It depends on the type of reconstruction that is done.
Okay.
For fat injections, you can practically return to work the next day.
Right.
Next day itself. While in implant surgery, I usually advise return to work at 5 to 7 days. And in case of flap surgery, 2 to 3 weeks before return to work is possible. And any vigorous exercise is deferred for 3 to 4 weeks in case of implant surgery. It's not deferred in case of fat injections, and 4 to 6 weeks for a flap. Well, there is my advice to the patient would be send as much data as possible to the treating surgeon, because it is on that, based on that he will take a decision as to which type of reconstruction he will do.